That is the time I promise you can use to start lowering a sudden spike in blood pressure right now without medication. I am Dr. Alex Moreno, cardiologist with 18 years of clinical practice and hospital experience, and today I will show you 3 practical, evidence-informed techniques that can reduce a pressure peak in minutes and 5 lifestyle strategies that lower your numbers month by month. Before we start, like this video and subscribe to the channel and tell me in the comments where you are watching from and whether you already measure at home. 1 in 3 adults will experience high blood pressure at some point, and sudden peaks raise the risk of stroke and heart attack, so knowing safe, fast methods matters. Warning note now, if your reading is above 180 systolic or 120 diastolic, or you have chest pain, weakness, or slurred speech, get to the emergency room now. Now let us go straight to what works and when to seek help. The problem is simple and widespread. High blood pressure or hypertension is common and sneaky. It often fluctuates with stress, caffeine, pain, or illness. And those spikes are not just numbers, they stress your heart and blood vessels. In population studies, higher peaks correlate with higher risk of stroke and heart attack independent of average blood pressure. Many people fall into a cycle where anxiety raises blood pressure, then the high number creates more anxiety, and the cycle repeats. This video will not tell you to replace prescription medication if you are already on it. These techniques are complementary, immediate tools for acute spikes while you follow up with your doctor. I will explain basic physiology simply so you understand why each trick works. We will look at 3 techniques you can use right away and then shift to longer-term strategies that change your baseline numbers over weeks and months. Technique 1 is warm water foot immersion and positional relaxation. Case story: Robert called me from his kitchen. He was sweating, his shirt stuck to the back of his neck, and his standard cuff read 165/94. He sat on a wooden stool, his soles numb with heat and fear. I had him fill a plastic basin with warm water and set his feet in for 15 minutes. The room smelled faintly of lemon soap, his wife Maria clicked the kettle off, and the clock on the wall ticked steadily. He pressed the cuff again after 15 minutes, and the monitor read 142/86. He told me his shoulders felt looser and his breathing had slowed. Science in 3 points. First, immersion of the lower extremities redistributes blood pooling to the legs, reducing central blood volume briefly, which can lower systolic pressure. Second, warm temperature produces local vasodilation, easing peripheral resistance. Third, the combined ritual activates parasympathetic pathways, increasing vagal tone, which calms heart rate and arterial tone. How to do it step by step. Sit comfortably on a stable chair, place a basin at your feet. Fill with warm, not hot water around body temperature to mildly warm, roughly 37 to 40 degrees Celsius. Test with your hand first. Soak your feet for 10 to 20 minutes. Lean forward slightly. Relax your shoulders, breathe slowly, and recheck with a properly positioned cuff at heart level. Safety and contraindications. Do not use this if you have obvious peripheral arterial disease, severe neuropathy from diabetes, numbness that prevents you feeling water temperature, if you are pregnant or have open wounds on the feet. If pressure is above 180/120, go to the hospital. Do not rely on home tricks. Scene with dialogue to illustrate how this felt in real time. Presenter: how do your feet feel, Robert? Robert: warm but comfortable. The water is soothing. Presenter: breathe with me. In for 4, 2, 3, 4. Hold for 4. Now out for 4, 2, 3, 4. Robert: my chest is less tight. I am surprised. Maria: should we call someone, just in case? I will wait and measure again. John the pharmacist later asked, what did you do? Robert: warm water and breathing. The cuff says lower. John the pharmacist: keep your meds unchanged and check again in an hour. In that scene, the water made a faint hiss. The towel smelled of detergent. The stool creaked slightly. His skin felt a slow prickle as circulation changed, and his pulse under the fingers was smoother. Technique 2 is tactical breathing, sometimes called combat breathing, a tool used by special forces and supported by controlled trials showing fast modulation of autonomic tone. Case story: Anna was in a packed supermarket aisle. Her palms were sweaty. She had just seen a high number on a kiosk, 162/96, and felt dizzy. She found a quiet corner near canned beans. The fluorescent lights buzzed, and the air smelt faintly of coffee. I coached her on the spot. We did 4 cycles that took 2 minutes, and the next reading was 144/86. She described the air feeling cooler and her jaw unclenching. Science in 3 points. Slow, controlled breathing increases vagal activity, reduces sympathetic output, and improves heart rate variability, which together lower arterial pressure. It also reduces anxiety, which itself reduces pressure hormones. Step-by-step practice. Sit or stand with your back supported. Loosen any tight clothing. Place one hand on your abdomen. Inhale gently through your nose, counting to 4. Feel your belly rise. Hold gently for 4. Then exhale through pursed lips for 4. Pause briefly and repeat for 2 to 3 minutes or until calm. Variations include longer exhalations to boost vagal tone, such as inhale 4, hold 4, exhale 6. Contraindications are minimal, but if you feel faint, stop, sit down, and do not hyperventilate. Dialogue to show the exchange with clinic staff and neighbor. Presenter: can you find a quiet spot, Anna? Anna: there is a small end cap. I can stand there. Put one hand on your belly and follow my counts. Anna: in for 4, holding now, out for 4. Neighbor Rosa: are you okay? Do you need help? I will try this breathing first. Nurse Lucas: check your cuff after 2 minutes. The number dropped. I feel less shaky. EMT Sarah later said, keep monitoring 2 readings and call if it goes back up. In that scene, you hear the fluorescent hum, the thud of a cartwheels, a faint metallic scent from tins, and the cool press of a plastic shopping basket against a leg. Technique 3 is a 60-second body scan and progressive muscle relaxation designed for anxiety-driven spikes and for use before sleep or after exertion. Case story: Lina works nights and measured 158/92 after climbing stairs. She sat on her bed, the lamp cast soft yellow light, the pillow smelled of laundry, and she shut her eyes. I guided her through a 60-second scan, tensing and releasing groups of muscles while focusing on sensations and breathing. After 1 minute, she checked again and saw 148/88. She said the tension in her neck unknotted like a slowly loosening knot. Science in 3 points. Progressive muscle relaxation reduces sympathetic drive, lowers peripheral resistance, improves sleep quality, and reduces nocturnal pressure surges. The technique increases interoceptive awareness, which helps you catch rising stress earlier. How to do it: lie or sit comfortably, take a slow breath in, tense your feet, hold for a count of 5, feel the pressure, then release. Notice warm sensation moving up your calves. Then tense and release thighs, hips, abdomen, chest, shoulders, hands, and face. Each time, breathe out slowly and observe sensations of softening. Use a quiet voice, timer, or soft music, and optionally a drop of lavender on the pillow. Avoid this method if sudden severe dizziness occurs. Stop and sit. Dialogue with family and a technician to show home reality. Presenter: lie down, Lina, close your eyes and start with your toes. Lina: I tense, now I feel a pressure under the soles. Presenter: hold, count to 5, now release. Lina: I feel a wave of warmth. Maria, Lina wife: the light is softer, she looks calmer. Technician Marco: keep a glass of water nearby in case you feel faint. Lina: I will measure after 1 minute. Nurse Lucas: record both readings and the time of day. Sensory details in that bedroom include soft cotton sheets, the faint floral lavender scent, the steady tick of a wall clock, the coolness of the mattress, and the muted hum of traffic outside, which all help anchor attention in the exercise. Pause here and join the conversation. If you found the first technique practical, tell me in the comments your city and your current reading. Start your reply with the city name. I want to know where people measure and how these techniques change real numbers. Commenting helps others see variability and creates content. That answers your real questions. Your voice matters, so write, for example, Chicago 150/92 and share whether you are on medication. This builds a community and allows me to bring follow-up videos tailored to common situations. Now a transition. These three techniques are immediate interventions, like a temporary bandage. They buy you time, calm your system, and lower peaks, but they do not replace long-term control. To reduce baseline blood pressure and lower the frequency of spikes, you need sustained changes that are evidence-based. Here are 5 to 8 long-term strategies with practical targets and brief evidence notes. Strategy 1. Follow a DASH-style diet, rich in vegetables, fruits, low-fat dairy, whole grains, and lean protein, and reduce sodium, ideally below 1,500 to 2,300 milligrams a day. Randomized trials show DASH reduces systolic pressure by up to 11 points compared to control diets. Strategy 2. Increase physical activity. Aim for at least 150 minutes of moderate-intensity aerobic exercise weekly, supplemented by 2 sessions of resistance training. Meta-analyses show consistent systolic drops with regular exercise. Strategy 3. Modest sustained weight loss. Losing 5% of body weight often lowers blood pressure meaningfully, and each kilogram lost can reduce systolic pressure by about 1 point in many studies. Strategy 4. Optimize sleep and screen for obstructive sleep apnea. If you snore or have daytime sleepiness, see a sleep specialist and consider CPAP, which can lower nocturnal and daytime pressures. Strategy 5. Limit alcohol to moderate amounts and quit smoking. Even small reductions in alcohol intake lower systolic numbers. Strategy 6. Monitor at home with a validated cuff. Measure after 5 minutes seated, arm at heart level, take 2 to 3 readings 1 minute apart, and record the average. Bring printouts to clinic visits. Strategy 7. Consult a nutritionist for sodium-potassium balance and consider professional guidance for medication when lifestyle is insufficient. Strategy 8. Consider stress reduction practices such as mindfulness, yoga, or structured therapy, which have randomized trial support for modest pressure reductions. For each strategy, seek individualized guidance, particularly if you have chronic kidney disease, diabetes, or other conditions. Names you may hear in this journey include Dr. Patel, the nutritionist, Nurse Lucas, the clinic nurse, John, the pharmacist, Maria, your spouse, neighbor Rosa, EMT, Sarah, and technician Marco, who performs home cuff calibration. Emergency instructions and concise conclusion. If you experience pressure above 180 systolic or 120 diastolic, sudden chest pain, severe shortness of breath, sudden weakness, or facial droop, call emergency services immediately. For less dramatic spikes, use the 3 techniques I described. Check your blood pressure after the intervention, document circumstances, and contact your doctor if numbers remain high or symptoms persist. Recap briefly. Pick one immediate technique to try now: the warm foot immersion if available, tactical breathing in public, and a body scan before sleep. Use home monitoring correctly, maintain your usual medications unless instructed by your physician, and adopt the long-term strategies over weeks. Dates to months to reduce your baseline. If this video helped you, please like, share, and subscribe for more practical evidence-based guides. Comment now with your city and your current reading so I can tailor future videos to your reality. Your heart responds to small, consistent changes. Start today, and your heart will thank you.